So now an important reminder as we head deeper into respiratory season. Adults 65 years or older remain at the highest risk for severe illness from COVID-19, flu, and RSV. Health officials say even mild symptoms can turn serious quickly. The CDC says adults 65 years of age or older account for more than half of all respiratory-related hospitalizations each winter, far more than any other age group. This age group also represents nearly 70% of COVID-19 deaths, even as overall mortality has dropped in recent years. The update: COVID, flu, and RSV vaccines can cut the risk of severe illness for older adults by at least 50%, depending on the virus and timing. Here to explain a little bit more about it is Dr. Juanita Mora. Welcome to the show.
Thank you for having me to discuss such an important topic.
Absolutely. Let's get right into this thing. What is it about the aging body and the immune system that makes respiratory infections more dangerous after 65?
Well, what we know, Chesley, is that our immune system weakens with age. So 65 years and older are going to have a weakened immune system. 2, people greater than 65 years of age and older are also going to be higher risk for chronic medical conditions that make it more likely to have COVID-19 complications, such as diabetes, high blood pressure, cardiovascular disease, asthma, or COPD, and emphysema. And the third thing is when we look at the data from October of 2024 to September of 2025, we have had 44,000 deaths in our country from COVID, and 2/3 have been in people greater than 65 years of age. This is why it's so important that we drive home the message that people get vaccinated.
I think a lot of people out there are thinking, you know, COVID is milder now. You're seeing less people wear masks. What about for our older patients? Is this actually true? Is it milder for them as well, or no?
Well, no, because what we know as well, too, in people greater than 65 years of age, repeated infections put them at higher risk for long COVID symptoms such as new onset asthma or COPD, and even complications such as strokes and development of Alzheimer's, heart attacks, arrhythmia. So this is why it's so important that we continue to get vaccinated and protected.
What about those that say, hey, I just have a cold, right? And they don't, and it turns into something serious?
Well, we want to make sure, one, that people continue to be tested, especially before we head into the holiday gatherings, right? Because we don't want to propagate this virus among our most vulnerable, the newborn babies in our family, the people greater than 65 years of age, anyone who might be on chemo, etc. So we want to make sure that people continue to get tested. COVID-19 test kits are still available at pharmacies. They're inexpensive, and they match well with the current actual virus that's going on right now for COVID-19.
Walk us through the red flag symptoms. You're talking about breathing changes, maybe confusion. You mentioned a few of those. Talk to us about those.
Sure. With COVID-19, what we're seeing now with the current strain that's circulating in our country is a lot of sore throat, high fevers. It begins like a regular cold. So it begins with a runny nose, nasal congestion, postnasal drip. But then it turns into some of the actual symptoms that we know well, that hard cough that people get that won't go away, and the wheezing that can occur. And then also people are getting the loss of taste and the loss of smell that continues to be part of COVID-19. Mm-hmm. Now, worrisome symptoms that I always teach patients, making sure that they go to an ER for any worsening shortness of breath or wheezing, a cough that won't stop, or any neurological changes, fatigue, or signs of dehydration. Because sick people sometimes can't drink or eat, so they might be sleeping all day, lots of fatigue, and are greater than 65 years of age, and our younger ones, we need to monitor that as well, too.
Yeah. All right. Lastly, for those that are watching who may be a little bit skeptical, right, what one piece of data or advice or anything that you can give them to help them, push them over the top to go ahead and get checked out, or get that cough checked out?
Sure. So first thing is go to a trustworthy website where you can get more information on COVID-19 vaccines. So that's going to be at the Champions for Vaccine Education, Equity, and Progress, CVEEP.org, or you can go to your local Department of Public Health, talk to your trusted messenger, your local doctor, your local pharmacist. Remember, COVID-19 vaccines are well covered under insurance, even Medicaid and Medicare private insurance. So 'tis the time to get vaccinated and protect. protected. And if you are skeptical, have the conversation with your doctor like my patients do with me. And I love, so that way I can share good information and clinical research and make it so you can make a decision based on science.
All right, Dr. Mora, thanks so much for your insight today. Really appreciate it.
You're welcome. Have a beautiful day.
All right, take care.